when we talk to pharmacies every day, Bonnie, we're telling, pharmacists wear a lot of hats. They're owners. They're taking care of patients. They're doing payroll. They're trying to run a business. They're looking at other ways of revenue outside of the PBM, and they're also got to be involved politically. You have to be as a pharmacy owner.
The hardest part right now that I see is they're doing all those things, and now because of the climate and the way everything is at the end of the day when they shut the doors, they're having to pull reports and figure out, their winners, their losers. They're looking at family units to see if they can keep patients that they're losing maybe on this drug, but maybe as a family as a whole, they're actually, making some money. And it's just incredible to me to have that kind of research in depth that they're having to look into this stuff, just to keep the business going. It's insane.
You're right, Bonnie, and that's a very astute observation on your part, because that's exactly what they're having to do. And
yeah,
and it's of course I'm from the state of Georgia, and we've had an example that our legislative session starts the second Monday in January and runs for 40 business days. It's recently ended, but this session they were trying to have legislation passed because it was discovered that the Georgia State Health Benefit Plan that's sponsored by the state of Georgia, that they're reimbursing independent retail pharmacies less than what chain pharmacies are getting. I mean, how ludicrous is that? Our own state is doing that.
I saw that, and didn't the governor veto or strike?
A couple of things. First of all, they did pass a study to be done to look at it. Now they did add some finances in there to compensate for some of it. However, there was a bill that the governor did veto that would have called for a complete revamp and a complete do-over of the whole system. And that was disappointing. But, the governor was concerned about the impact it was going to have on the state budget. And I want to believe that, once this study is completed and the data gets out there, that it'll help them to understand how big the problem is. Now, the concern that we've got is what happens in the interim, because we've got pharmacies that are closing every day. I mean, the number, I think there were over 300 independents that closed last year, almost 4% of all the independent retail pharmacies. And that's a problem. And I say it not only from being a pharmacist and concerned about pharmacies, but also as a healthcare consumer, because at the end of the day, all of us, whether you're a Republican, a Democrat, or independent, we want the same thing. We want accessible, affordable, quality healthcare. Accessible. Pharmacists are the most accessible healthcare professionals in America. 95% of all Americans live within 5 miles of a pharmacy. Now, within independents closing, particularly in the rural areas, that's going to be impacting the accessibility of healthcare in our country. And that's something we need to be concerned about.